Hi there, this is Professor Marvel. I'm doing the um, exam, the HESI review for my PN, for PNs. So far, I don't have anybody here, but I'm going to do a recording. Um, so if you do come in, well, doesn't matter. Anyway, let me do start with the recording. There's two things I want to review today, which is the HESI prep guide that you guys have all completed, or most of you have completed in the last week. Then I want to review some test taking tutorials. Um, so um, let's actually start with the test taking tutorial. I'd like to do that first. Or test taking, it's called test taking skills. I probably need to go back and make sure I'm sharing my screen. So let me do that. Okay, you should be able to see that now. This is from our instructor resources in Elsevier. It's test taking skills. I actually have provided this to my students early on in the term. So I just want to review this for HESI. Okay, so we know that testing techniques or knowing about testing techniques certainly enhance your preparation and your study for an exam. All right. So nothing can replace learning information through however, nothing can replace learning the information through adequate preparation. And you've had plenty of preparation this term. You have had weekly lectures for you to attend. If you haven't been able to attend them, you have had um, recordings for each of those lectures. You have had weekly notes sent to you every term as kind of a summary of what's going to be covered. You have had assignments, you've had discussion questions, you've had case studies, you should be working on your vulnerable populations assignment now. We did group projects. So you've had plenty of resources throughout the term to prepare for this, as well as all your readings that have been assigned every week. Okay. I would suggest that if you've missed any lectures, that you go back and review those lectures. Or if you've missed any portion of the lectures during the 2-hour time block, go back and review those as well. I would suggest that you pull out your 3 study guides for exams 1, 2, and 3, and review those as well, including your HESI prep assignments. So those are the 4 major documents, your 3 exam study guides from the term, and then your HESI prep. And I'll cover a little bit more about the HESI prep in a minute. So here are 10 steps to answering a test question. Cover the options, read the question, determine if the style of the question is a positive or negative question, identify the keywords in the question, ask yourself what is really being asked, rephrase the question in your own words and answer it, uncover the options and look for one that matches your own answer. So review the other options and rule out any options that are clearly incorrect. And then consider the options that are left based on nursing principles and your knowledge of the subject. Remember, we're moving into next gen, and next gen is all about clinical judgment and critical thinking. Okay, and then make your selection. So covering your options. I'm not sure you're going to be able to use a sticky note to cover your options, but maybe you can just bend your head and kind of put your hand over your forehead. And after you read the question, don't read the answers just yet. All right. When you read the question, read every word. Do not read into the question. All the information you need to select an answer will be in the question. We're not asking you to think what happened 6 months ago. Well, what if this and what if that? We're not including that. That shouldn't be included in your thinking. Everything you need to select the answer should be right in the question. Okay, so don't overthink it and read into it. Okay, then determine if the question is written in positive or negative style. So a positive style may ask what the nurse should do. What's the best or first action to implement? Okay, so what is, and then compared to a negative, may ask what the nurse should not do, what the nurse should avoid. Which prescription, an example, what prescription should the nurse be questioning? Which behavior indicates the need for reteaching the client? Or which behavior by the nurse indicates a need for re-education if they're teaching a patient? Okay. Find the keywords in the question. I find through a lot of my student reviews of exams, this is a really big issue, is pulling out keywords and phrases in the question, okay, that will help lead you to the correct answer. All right, so you need to ask yourself, which words or phrases provide critical information? Okay, it could be the age of the client, could be the setting, the timing, set of symptoms or behaviors. Could be words like, what is the first? What is the initial? What is the last? What is the greatest? What is any of those priority words that would lead you to highlight and know that that was an important word in the question? Okay. So here's a good example. The nursing actions for a 10-year-old 1 day post-op are different than those for a 70-year-old 1 hour post-op. Okay, so big differences in that. Age is a difference. Time of post-op is a difference. One is 1 day post-op, one is 1 hour post-op. Okay. Then ask yourself, what's really being asked in the question? Okay. Well, still keeping your options covered, try and rephrase the question in your own words. All right. This may help you eliminate some non-essential information in the question, will help you determine the correct answer. Okay. Rephrasing. How do you rephrase the question in your own words? Right. So we know that every test writer is different and each one has their own writing style. Right. Sometimes writers will use different terminology that you may not be familiar with. Don't be confused about that. All right. Don't get stressed out about the change in writing styles. Rephrasing the question in your own words may help you to understand the meaning despite the presence of unfamiliar terms. Okay, now we're into step number 7, and now we're going to uncover the answers. Okay. Okay, so here's a couple of examples of different writing styles. The person who prescribes treatments may be referred to as a physician or a healthcare provider rather than a doctor. Something to keep in mind. Okay. The unskilled person who assists the nurse may be referred to as a nursing assistant, nurse's aide, a patient care technician, unlicensed personnel. Maybe the term orders may be referred to as prescriptions. Okay. Okay, so reviewing the other options and try and rule out any options that are clearly incorrect, right? So based on your knowledge, can you probably identify 1 or 2 options that are clearly incorrect and that you can cross out? Okay, so you can cross out using the highlighter that's in the test, or you can mentally cross out these options in your head. Either way. All right, so then you can consider the options that are left based on nursing principles and your knowledge of the subject. Okay, now you should differentiate between the remaining options. Consider related nursing principles to your knowledge of the subject. You need to be thinking about safety, your ABCs. You need to be thinking about nursing process. You need to be thinking about prioritization. You need to be thinking about hierarchy of needs. Okay. And then you make your selection. Okay. Couple things about that. If you read through a question a couple of times and you still can't make sense of it, you don't have any clue, just make an educated guess and move on. It's one question. Okay. Do not get stuck on one question and read it, 5, 7, 8 times. You're just going to get frustrated. Your confidence may be affected. So just remember that. Read it a couple of times. You're going to know if you don't have a clue. Just make the best educated guess you can and move on. This test doesn't allow for you to skip questions and return to them later. So you need to make sure you're answering every question when it appears on the screen. Okay. And then obviously use this as an opportunity for positive affirmation. Am I sure? Of course I am. I know this stuff. Try and go into this with a positive mindset. Okay. With regards to changing answers. Okay. Do not change your answers unless you can concretely articulate to yourself why that answer needs to be changed concretely. Not, well, I think I heard Professor Marvel mention that in a lecture. I think I read that in the book. I think I read that in my notes. If you're thinking but not sure, don't change your answer. Okay. So those are a few, let's see, let's finish up. Correct answers are to most test questions are based on generally accepted norms. Okay. Students with clinical experience outside the school setting may erroneously consider factors that are not part of the question. I run into this all the time in community where people are working outside the community and maybe EMTs, firefighters, working in a nursing home, working in an urgent care clinic. You need to take off those hats and go into this test as thinking or practicing in the community. You're taking care of patients in the community. Okay, so take off all those other work hats and the past experience work hats and just work off you are a healthcare provider in the community setting. Okay. I kind of mentioned this earlier. Your answer to the question should be based solely on the information provided in the question. You're not expected to think of the what ifs or, well, could this have happened before? What if this was in play? No, the answer, all the answers you're selecting are the information for the answers you're selecting are in the questions. Okay. And there's my avoid the but what if. Okay. Don't think what if. Okay. In the world of testing, unless told otherwise in the question, you have an unlimited amount of time, staff, medications, and equipment. Okay. Don't second guess yourself. Trust your answers. Okay. If you have studied and prepared, questions may seem easy or just plain common sense. That's great. Okay. So that's a few reminders for test taking skills. I pulled up, I'm not going to disclose the name of the student that this is their HESI prep, but I pulled up a sample of a HESI prep that was excellent and just wanted to go through, the structure of the study guide. Okay, it's broken out your HESI prep. Okay, this is a document that should have been filled out all throughout the term. And I mention this probably weekly, that as we go through and cover material, you should go right back into here and fill this out. All right, so this is broken up into, I think, about 6 sections. Bioterrorism, disaster, epidemiology, health promotion and teaching, home health, infectious disease, and then vulnerable populations. Okay, some of you didn't use this updated one. It's not a lot different, but it is a little bit different. So the way I could tell is which version you use, whether it was in the week 1 or whether it was the updated copy that I provided to you. So the week 1 was from last term. And so in going through, and I sent out an announcement, I think in the first week or second week, saying, please disregard the link, the HESI prep assignment that is in week 1. Here is a copy of the most updated one. Most of you use this one, but I did notice that there were students that used the one from week 1. So you might want to just compare. Okay, because what I did is I updated this based on last 2 terms of HESIs. Okay, I can't see the questions in the HESI. It's like NCLEX, they pull them from a large bank, but I can certainly see the topics that were asked about. Okay. And as I go through all of your remediations, that's where I see the topics that were asked about, what you answered correctly, what you didn't answer. So I went through and at least made a list of the topics that were covered, and I updated this study guide to cover that. All right. So in the original version that was in week 1 that I asked you to disregard, that some of you used, there's extra information in there. This particular document is the most updated version. So in going through HESI from last 2 terms, these were the topics that came up. Okay, so there was a question about anthrax incubation. There was a question about smallpox. There was a question about Ebola. And there was a question about sarin. So in the original HESI prep, if it had anything other than these 4 topics, then they were not asked in the last 2 terms of HESI. And that's why I want to make sure that people who use the old version, compare it to this new version. Okay. And what I was asking you for in the directions was to complete each box based on nursing process, right? Your ADPI guidelines. Okay. Using your critical thinking skills. So how do we apply the nursing process from assessment to evaluation with each of these topics? Because as we know, ADPI applies in the community setting as well. It just looks a whole lot different. How do you assess a pediatric patient in the hospital versus how do you assess a pediatric client in their home? Okay, what does assessment look like? It's going to look a lot different in the hospital setting than it is in the community setting. Okay. So anyway, so I would use your HESI prep as a study guide for studying for HESI. Okay, these are all the topics that were covered. So for bioterrorism, we had the anthrax, the smallpox, the Ebola, and the sarin. Okay, and this student did a particularly nice job of identifying what it is, what in your assessment you may, what the client, what the patient may present with. Okay, what the symptoms were, and then how would we treat it? So for example, let's look at anthrax. Okay, it can be, I'm not going to go through every one, but I'm just pointing out what this student did based on the directions of using the ADPI. So anthrax can be contracted through aerosol particles, ingestion, skin contact, or injection. Okay, how do we diagnose it by taking samples from blood or respiratory secretions, from skin sores. Okay, a little bit about anthrax. Infection usually develops 1 to 7 days after exposure. What are the symptoms? It may include skin sores, vomiting, and then how is it treated? Antibiotics can cure most anthrax infections. So this student has pretty much gone through the nursing process, the ADPI, to describe anthrax. Okay, smallpox. How do we manage smallpox? We have to isolate the patient to prevent transmission. Okay, monitor. What are some of the nursing interventions we're going to do? Monitor and maintain fluid and electrolyte balance. Skin care. What about treatment? There's no known treatment for smallpox. Okay. And she also indicates that there's a vaccine is the first line of treatment. So again, if you've thought about each of these boxes as you were going through the nursing process, you will have a good understanding of each of these. Okay, let's go to the next section. Disaster. Okay, there were 3 topics we wanted you to know about disaster. These were some, looks like we were asked, or you were asked, what's the difference between a level 1, 2, 3 disaster or something about that? Okay. What about disaster planning? There must have been a question asked about disaster planning. So nurses should proactively seek out disaster training in their work settings and advocate for some sufficient supplies and support, right? Will be called out. Nurses will be called out to assist at whatever level of disaster, whether it's preparedness, response, aftercare. And then specifically, there must have been a question about red tag. What's red tag? Okay, red tag is a class 1 emergent. Okay, immediate threat to life, such as airway compromise or shock. Okay. Next section was epidemiology. What do we want to know about epidemiology, or what was asked to you asked to students the last 2 terms about epidemiology? You were asked about influenza. You were asked about COVID, about SARS, about CDC reportable diseases, and what is vertical transmission. Okay, so this student went through and described influenza, highly contagious infection of the respiratory tract. Okay, what does nursing management include? ABCs, patent airway, normal temperature, increased fluid intake. And then the teaching, important to remind patients to wash their hands. Okay, antibiotics prescribed when it's a bacterial infection. So again, the student did a very nice job identifying what the nursing process is for all of these conditions. The next section was health promotion and teaching. Okay, and I even went through over on this side and put little bullets in of topics that seem to be covered. Okay, infant death rates, lipid screening. And this was under the section of preventing health problems. Okay, lipid screening. So she put in here, lipid screening is recommended for all children between 9 and 11. Right? And what is lipid screening? That's in there. Recognize alterations in health. Okay, there was something about conjunctivitis, diabetes, and eczema with school sports. Okay, so please pay attention to this prep guide. This is your best opportunity. And then take out your study guides. Okay, what's a heart healthy diet? Family health. What's an elder health assessment? What's a family eco map? You've all completed your HESI prep guide. And actually, most of you, the majority of you, did a great job. So go back and review your HESI study guide and pay attention to the little bullets I put under each topic. Okay? So this is the most comprehensive HESI prep that you're going to have. Use this to study for your HESI. Okay. Since I have nobody here, I don't have any questions to ask. I just want to review that. If you have any questions, please reach out to your instructor, either Professor Kershaw or Dr. Ford, and go through any questions or topics or concepts that you may need additional support with. Okay. So good luck on your HESIs, and we will talk soon. Thanks. Bye.